I'm Shelly Deutmeyer with Physical Therapy Solutions, and our topic this week is arthritis and different forms of arthritis and what physical therapy can do with them. When I first started looking into the topic to research a little bit more about what I was going to talk about today, there's actually over 100 different forms of arthritis. We'd be here forever talking about these, so in a lot of the websites, they talk about the 5 most common forms. So I'm going to hit on the 5 most common that you're going to hear and see if you can learn a little bit about each one of them. The first one that we're going to talk about today is the very most common form of arthritis is called osteoarthritis. And this is a form of just kind of general wear and tear on the joints that can lead to stiffness and pain. Everybody at some point in their life is going to develop some form of arthritis, some more severe, some more mild. It's just the natural wear and tear of our joints over time. Here's a picture of a normal knee joint right here. As you can see in this picture, on the edge of the bone, this is the lower leg bone, the upper leg bone, there's a thin lining of white cartilage. In a normal joint, it's a nice even spreading of cartilage, and there's a nice pink spot or joint space in between. Now, as the joint becomes affected with arthritis, one of the things that first starts happening is this lining of cartilage starts to thin and wear down. As that happens, then you might have a little bit more contact where there's less cartilage, and then you get some bone-on-bone area. These little white fragments in here can be pieces of bone fragment called osteophytes that get trapped in between the knee joint and can ultimately cause pain for some people. One of the things they talk about is maybe what are some contributing factors to arthritis. A lot of people want to see what they can do to try to avoid getting the arthritis or prolonging it as long as they can. Some of the common causes, again, there's no specific cause that is going to say that yes, you are going to get this, but a lot of things that can lead to it is being overweight, and there is also some genetic factors in it as well, as far as just injury to a joint and overuse. So what can physical therapy do for you? When we come into therapy, the biggest thing we want to do is we want to get as much motion in the joint as possible. If your joint can't move normally, it's going to hurt or have stiffness. So we want to get as much motion back, and then with the arthritis, you just really want to strengthen the muscles around the joint as much as possible. This will take some load and stress off the joint and get you back to doing things that you want to do on a daily basis. Our next form of arthritis is called rheumatoid arthritis. When you think of this, you're going to think of more, sometimes you see the real deformed joints. This type of arthritis is an autoimmune disease where our immune system keeps our system healthy, but for some reason it attacks foreign substances like bacteria and viruses, and it mistakenly attacks then the joints. And then that causes pain, inflammation, and even deformity at times. So in this picture with the rheumatoid arthritic hand especially is what people are going to be thinking of. You can see where there is the swelling or the enlargement of the joints and even some joint deformity. And here in this picture here, you'll see around each joint there's a little like a membrane that protects the joint, and this is called a synovial membrane, and a lot of times that becomes thickened or swells, and that causes those those larger joints, especially at the knuckles. Common symptoms that people will get along with kind of joint inflammation and pain that we talked about is they may have just kind of overall fatigue, loss of appetite, and maybe even low-grade fevers. Because rheumatoid arthritis is a systemic disease, it may also affect other organs or body systems. The cause, therefore, is not really known yet and fully understood at this time, but again, it is a response of the immune system playing a role in leading to the inflammation and the joint damage that occurs in various parts of the body. So what can physical therapy do? Again, kind of like the osteoarthritis, you want to try to to put a stop to the inflammation as much as possible with the help of your medical doctor. This may come in the form of medications. It may become in the form of some activity modification or finding what types of activities flare it up or calm it down. You want to try to prevent things and self-manage for the long term because this can be a very debilitating condition. However, if it's managed well, people can live with rheumatoid arthritis for a very long time. Psoriatic arthritis is the third type of arthritis that we're going to talk about today. Many people have heard about the condition called psoriasis. That's that skin condition that people may get often on the ends of the elbow, sometimes on the knees, where it's like a white, scaly rash type condition. Now, 30% of people that have psoriasis will also develop a form of inflammation in the joints called psoriatic arthritis. In this condition here, you can see in the picture again, just like with the other forms of arthritis, you have normal levels of cartilage. In the beginning stages, it's starting to break down a little bit, and then as the disease progresses, then you have a lot more breakdown, and it even starts to affect the joint and maybe have some breakdown of the bone and the joint itself. Fibromyalgia is our next form of arthritis. Many people have heard of this term, but they don't always associate it that it is a form of arthritis. There's approximately 3.7 million Americans that suffer from this condition. It's a condition that's associated with kind of widespread chronic pain, fatigue, memory problems, and also mood changes. The thing to know about fibromyalgia is that it's not just a single disease, but it's kind of a whole multitude of symptoms kind of put together. It can be a difficult condition to diagnose, and therefore it is usually over a significant period of time where their doctors are monitoring your signs and symptoms before they're going to diagnose you with fibromyalgia. Physical therapy can therefore see and treat a lot of the patients with fibromyalgia. One of the biggest things that we do is we focus on educating the patient about the condition and starting them on an exercise program that works for them. A lot of times they want to try to get active, and the minute they do something they get so sore and so flared up, and then they don't want to do anything. So we start them on a very controlled and slow program, so that way their body responds to it positively instead of negatively to help keep them active. Our last form of arthritis today is gout. Again, a lot of people have heard about this, but they don't always associate it that it is a form of arthritis. This is an inflammatory arthritis that develops in some people where you have really high levels of uric acid in the blood. It occurs in about 4% of American adults, but it's more likely to affect men than women. From this picture, you can see a lot of times this buildup or this excess uric acid forms in the joint, and most common you're going to hear about it in the big toe. And as a result, the uric acid crystals accumulate, it inflames, and that joint will get really red and swollen and very, very, very painful. So treatment for this, you're going to see your doctor for it. They're going to control it with medications to help get down those uric acid levels. And in severe cases of pain, you can also ice and elevate the joint, drink lots of fluids to help get the fluid levels in your body back to normal. Relaxation as well, because stress can also aggravate this condition as well. That sums it up for the different forms of arthritis that we talked about today. If you have any questions, you can feel free to call us at our Dyersville or our Manchester clinics, or you can also log on to our website at www.ptsiowa.com.